Hello, I'm John Urbans, President and CEO of Greater Fort Wayne, Inc. Welcome to the Roadmap to a Healthy Reopening webinar series. Today we will be focusing on extracurricular activities and athletics. I want to thank our partners, Parkview Health, Greater Fort Wayne, Inc., the Northeast Indiana Regional Partnership, and the Allen County Department of Health. Several weeks ago now, Governor Holcomb rolled out the Back on Track Indiana plan. Allen County and all of Northeast Indiana entered stage 3 last Friday, May 22nd. We continue to get new guidance, and this webinar series will help answer questions related to extracurricular activities and athletics. For housekeeping, we will have substantial question and answer time during this webinar. We will be using the Q&A tab at the bottom of your screen. We have received a number of questions ahead of time, so we will work through those, and we will use the Q&A tab that is located there. Following the webinar, you will be receiving an email that contains a link to a survey. You will also receive a second email that has a link to this recording, as well as the slides that are presented today. I want to thank you for submitting those questions ahead of time so that the team at Parkview Health and Health Department could develop the content today. You may not hear your specific question asked, but we hope that the information you received will help address your most pressing concerns. At this time, I'd like to turn it over to JoLynn Succo, Chief Innovation Officer for Parkview Health.
Thank you, John. Like John said, I'm the Chief Innovation Officer for Parkview Health. Boy, the last 10 weeks have been quite a time of innovation. We're coming to you today from the basement of the Miro Center in a large room that is serving as our makeshift studio, where we're all practicing social distancing and washing our hands with hand sanitizer. We're also feeling very, very grateful that the surges, for all of your work and for the community's work, that we've kept the surges to a manageable level. And we're thinking about, and we are getting back to business. So I want to share with you a few of the principles that are guiding our plans as we get back to business, in hopes that they may help you. So the first principle is the virus is here, and we're going to continue to have cases. It's in what's known as community spread, which means it's not limited to one place or area, and it's much harder to pinpoint the source. So it's part of our everyday. We don't expect a vaccine for another 12 to 18 months, and we don't have enough infection to confer any type of herd immunity. So our goal is to keep the surges as low as possible and as many people as safe as possible. Over the last 10 weeks, we've been implementing and evolving our safe practices to help our employees, customer, and community. You may know us as healthcare, or where you receive your healthcare, but we are the largest employer in the region. So we operate 10 cafeterias. We have a large athletic training staff, a huge grounds crew. When we run a hospital, we have sort of traditional hotel services, an EMS, and a police force. So throughout all of our company, we are re-engineering and innovating as we respond to this pandemic. We're here and we're ready to serve. We're really monitoring the situation very, very closely, and we are restarting our services gradually and methodically. As of today, our visitor restrictions are still in effect. We're also wanting to pay back to the community some of the gratitude that we have for all that you have done for us. And we're sharing our practices in our Parkview Business Connect. Parkview Business Connect is a website and a consulting service wherein which we share lots of great practices from Parkview, but also from Northeast Indiana and around the world in industry-specific areas. As we think about schools and the complexity of schools and athletic venues reopening, we're really focusing in and want to be elbow to elbow with you. We will be posting a playbook for how to reopen safely, leveraging the CDC and state and local guidelines, Parkview's best practices and best practices from the region. And we will be posting probably in the next couple of weeks some walkthrough videos of activity spaces that are very common. So you can head to our website and see those as they post. This is a dynamic and changing document, and it changes as we get new information or new best practices. The number is 260-CONNECT. Someone will get back to you within a business day. You can also submit a question on Parkview Business Connect at parkview.com. And we look forward to staying in dialogue with you and helping you as we navigate this new opening. So John, I'll turn it back to you.
Thanks, JoLynn. I mentioned earlier Governor Holcomb's back on track Indiana plan, and that we were in stage 3 as of last Friday. He moved it up from Sunday to Friday. You know, that back on track plan is really focused on some 4 key core guiding principles. First, that the state continues to see a decrease in the number of hospitalized patients, that the state retain the capacity or surge capacity for critical care beds and ICU beds and ventilators, that we retain the ability to test symptomatic individuals as well as first responders and essential workers, healthcare individuals, and then also that we continue to have the ability to do contact tracing for people that do test positive, so that we can continue to determine who people have been in contact with. Those are the guiding principles that are going to lead us from now stage 3 into stage 4, and then ultimately stage 5, where it's a much wider reopening. I know for this crowd, getting to stage 3 has been kind of a key point, because I know my son, for example, started soccer practice this week, and I know I saw a lot of Facebook posts with people back at practice and some small scale sporting events. So starting to see us move into stage 3 is a good sign. The state wants to see us continue to keep those guiding principles in place as we continue to move forward in that. Just to give you a couple quick updates on where we're at. Today is really part 3 of a number of educational seminars that have taken place, or event specific. If you haven't been on some of those, you may want to go back and check out some of the education or the K-12 webinars that have taken place. There was also one specifically on events and venues that took place just a couple weeks ago. But then the team is really prepared to answer questions around those extracurricular and athletic events today as we move it forward. I think at this point, I'm going to turn it over to Heather Schegler from Parkview to continue the conversation.
Thank you, John. As a mom of a musical theater daughter and a travel hockey player, I understand the importance and desire from all of you on this call to return to our gyms and our fields and our auditoriums. And I'm excited to be a part of the team sharing this information with you today, so that you can do so with a mindset and a purpose to minimize the spread of COVID-19 in our communities. We recognize this afternoon that as you sit here, you likely stopped activities earlier this spring, perhaps pausing or ending a season prior to your planned end. Maybe you didn't get to start your season at all. For others, you delayed or postponed performances, and we're hoping that today we're able to share practical information with you so that you can safely resume activity. Thinking about our spaces and our people, we really want to prepare you to create this plan. And one of the things that we recommend, as well as the CDC, is to identify a COVID-19 coordinator for your organization. So this is someone or a team of people who are the point person for sharing information with your staff, your volunteers, and your families. When you build this plan, one of the things that we've learned very well over the last 8 to 10 weeks is that we have to be flexible. We have to be nimble and responsive in this plan. We're probably not going to let the ink dry too long, and we're going to continue to learn and evolve our practices. One of those things that we want to encourage you to do is to think about those things that you're going to take with you when you open back up operations. What have you had to do in this time of pandemic that really has worked well for your organization and for your parents, for your children? One of the things we've seen that athletics and activities have done really well is transfer our in-gym or in-auditorium practices to a virtual space and offer virtual training. Also offering live events and competition via technology similar to what we're experiencing today. You should also be thinking about how you slowly phase back in people to your facilities and spaces. So at Parkview, we have 4,500 of our 13,000 coworkers working remote right now. And when we're ready to bring them back into the workplace, we're doing so in a phased approach. So think through your activities and consider who should come back first, and how do you thoughtfully design your plan so that everyone isn't entering back into the same space at the same time. Also consider those policies and process for supporting your vulnerable. The vulnerable might be your staff or volunteers. It might also be the children that you're interacting with. And having those processes identified ahead of time will better prepare you so that you're not having to react in the moment. And we're happy to provide those resources to you, the things that we have in place and would recommend through our Parkview Business Connect resources. Finally, as you're thinking about preparing and really developing a best practice plan, consider getting feedback from your staff and your volunteers. What do they need to return to the activity? Ask your families. You know, they're signing their children up, they're allowing participation in your sport or your performance or other activities. What makes them feel safe about allowing their children to continue or return to participation? You know that they have an opinion, and so part of this is that ongoing dialogue with them on why you're making the decisions that you are, and that you have the children and their families' health in mind at every point. We think that that happens through communication and also education for all of those audiences, so that they understand not only what you're doing, but how they can be empowered to reduce the spread of virus as well. A few things we've seen where this works really well to communicate and educate, again, is prior to activity, but hosting some virtual staff and volunteer training sessions so that everyone knows prior to return what they can do to reduce the spread of the virus. And then also hosting some virtual parent meetings so that they're well prepared on the experiences that they're gonna have when your activity resumes. With that, I'd like to welcome Dr. Nip, who's gonna share some more athletic and activity insights.
Thank you, Heather. Hi, everybody. Dr. Mike Nip here, occupational medicine physician. Wanting to get the conversation continued here around athletics and activities with a couple of insights for you here. Getting started. So as we mentioned briefly, identifying a COVID-19 coordinator for your organization, finding a point person or point persons. It takes a team on the field and a team off the field. And this person or group is trying to, again, communicate preventive measures, the training that's being done, and any changes in scheduling that might need to be done, sometimes even a few hours before a practice or a performance or something like that. They also should work to be the one source to answer from consensus on COVID-related questions. And the second point to do is to determine if you're ready to open and begin doing all of your activities, and have a plan, because figuratively the lifeguard has said in stages everyone can go back in the pool, but to make sure you have what you need to go back in. July 4th. So We know that that is a mile marker from the governor. There's one a few days before, I believe, regarding sports. This is a mile marker, not the finish line. It's a time for all industries and sectors to take fresh eyes and look at things that maybe we should have been doing before, but that are good ideas now and will be good ideas from now on. So I want to bring up this slide real quick. The hierarchy of controls. This is a concept that comes from the core industrial hygiene literature. It is an approach that an organization or person takes regarding any exposure, specific a tiered step approach to minimize and optimize the exposure. Up at the top real briefly, you can see elimination, engineering, administrative, and then down at the bottom is PPE. Now everyone is probably by now familiar with this, but really regarding sports and some extracurricular, there's been PPE used for a long time. These are your helmets, your face guards, your elbow, knee pads, those sorts of things. The statement at the top is more than a mask. That is something we have been saying at Parkview, that masking is not the first and last thing you do. We try to go as high up as we can regarding an exposure in a certain process or place to find a solution that can minimize exposure. Another slide here just to call out a couple specific things. For example, with elimination, if you had to pin me down, the biggest takeaway is people that are symptomatic or ill, staff and athletes should be asked to stay home, not practice. If they are a potential exposure, if they're not there at that event, they can't infect people. Engineering controls work to affect the environment. There's a few examples there. Administrative controls affect the way people behave in a space. And these conclude, just like the top, everyone becomes a self-monitor for any symptoms. This may face outward to spectators and other folks too regarding how do people use the space in a new way, like the stadium or the practice field. It could be prompting traffic flow where people stand, those sorts of things. And there at the bottom on PPE, as a suggestion, you might have all or most staff wear a mask. Not a requirement, but it could be a part of a policy that you implement. A couple things here from the CDC that are simple to help stop the spread and optimize and minimize exposure. These are both for staff and children or student athletes. Again, reiterating here, everyday preventive actions, staying home when you're sick, following cough and sneeze etiquette, cleaning and disinfecting surfaces that are frequently touched. This scopes out to sports with equipment, both in the training room, locker room, and then also out on the practice field. Same thing regarding extracurriculars, if it's a play or a musical or something, what are props and things that may be handled frequently, lights, cameras, those sorts of things. And the one at the bottom, this has always been good advice, remains good advice, washing hands, soap and water preferable, but if that isn't easily offered, an alcohol-based hand sanitizer should be used. A couple other things real quick here, specific more to athletics and activities. We want to not share or minimize shared equipment. We may need to up the laundering schedule regarding uniforms suggested after each use. Cleaning equipment regularly at home. The EPA has put out a recommended cleaner list to use, and there are good resources on frequency as well. Personal items like a mouth guard. These probably are not clean things before COVID, and we're trying to make them cleaner now and later, but after kind of similar to a toothbrush, replace after you've been ill, replace mouth guard if there's been someone who's ill as well. Sports physicals, it's that season again. These really should be locked in with a child's pediatrician or primary care doctor. Not that a sports med physician or myself, as I have done these as well, can't do them, but again, it dovetails with the recent push to get kids back into their pediatricians or their primary care physician because there has been, unfortunately, some interruption in care. It's a good time to get the sports physical done, catch up on any preventive or wellness screening that's been done. With that, I'm going to turn it back over to John for some Q&A here.
Thank you, Dr. Nip. Now we've got a great deal of time to get into some Q&A. So again, just a reminder, the Q&A tab is open down at the bottom of the screen if you want to submit a question. Some of those will be answered live. Some may just be typed in for your response. We've got a number already in the slide deck that were submitted early, so we'll get through those first. But we will get to that tab if you want to submit something. One of the questions, what do we need to know about multi-system inflammatory syndrome in children? We know children aren't at a high risk to die from COVID-19, but do we need to be concerned about the new development?
Sure, this is Dr. Nip. I will start. I'm going to put on my pediatrician hat a little bit. I will let you know, Dr. Tony Giaquina is who I asked this question to. Here is summarizing some of the points he made. We can assuredly take any questions that come through, get those to him and get an answer back. But, so this is something that has been very, very much in the news recently. We do know exactly right, John, that you read that children generally do not have a very severe course from this virus and this disease, but this syndrome has been identified. It really, at this point, we still kind of stay the course. We don't change the course of action like we said. In any place, we had child care centers on here, but we know there's Dr. Coach and Dr. Trainer who are kind of watching. They know their student athletes, they know their participants. That's many times they get the first notice that something is, hey coach, hey trainer, I'm feeling this. They also are very, very expert on knowing the students and knowing the student athletes when, the kiddo seems to not be running as quickly or something is wrong to communicate that, but to also loop that child's primary care provider, pediatrician back in if there's any concern regarding anything that seems out of the ordinary. That's always been good advice. It remains good advice. Dr. Maddox, do you have anything to add?
I agree with that. Essentially, it's just looking for, our athletic trainers in the area with Parkview Sports Medicine and our partners are very in tune with all their athletes. So when someone's outside the norm, we should get them back to their primary care physician, pediatrician, and get further evaluation.
We've obviously seen the spring sports come to a screeching halt. What's the prognosis for fall sports activities or spring of next year?
So this is Dr. Nip. I'll start and I'll let my colleague, Dr. Maddox, chime in. And I think we're all in kind of a holding pattern a little bit from an education-based standpoint, because there will be updated guidance from the governor here a couple months. But I would anticipate, Dr. Maddox, in a minute you can chime in, some sort of return or sport and extracurricular this fall. The W's and the H there, not sure what it's going to look like. I wanted to highlight the simmer strategy line there. So the burner on the stove got turned on all of a sudden back in March here. We did things to try to abruptly turn it down. The only way to completely turn off that burner, meaning the virus, is a vaccine, but we're trying to do strategies that keep it on simmer on very low heat, and that's what everything is geared towards too. And the focus still remains safety, things like that. Spring season, I'll let you chime in here. Fall, again, we're not sure about the vaccine. I think that should say summer 2021 or later for the vaccine. But again, there are some conclusions with a small c we can sort of make, knowing that it will be different, but I think it will be something. Dr. Maddox.
I agree. This is Joe Maddox, and I agree with everything that Mike is saying. Essentially, we've got to prepare all of our partners for what this will look like, and we're waiting on organizations like the NCAA, the IHSAA, the OHSAA to come through with their recommendations on what we can do. And the best thing we can do up to that moment is prepare so we're ready to do what we believe is going to be the new norm, if I'm allowed to say that. And then, yeah, the new norm is going to keep changing. The goalposts will keep moving. It depends on what things look like as far as a vaccination, treatment, what the peaks look like, what the spikes look like, what phase we're in based on your local governments and CDC recommendations. So there's no easy answer to this. It's going to be, as Heather mentioned earlier, we're going to have to stay liquid, stay quick, and be willing to respond to whatever recommendations are coming through from higher ups.
You know, we've talked a lot about sports. I mentioned I'm a soccer dad. I'm also a show choir dad. So, you know, do teachers and coaches need to wear a mask in a gym, a choir, or a band setting?
So this is Dr. Nip to start. This is a good question. I have 2 daughters in show choir, one son that does martial arts, and masks and certain activities are going to be a tougher fit because in any industry as an OCDOC, the process cannot interfere with safe performance of the task. And so the sports field, especially, that might be a different situation, but we want to, again, start at the top of our hierarchy with more than a mask. I joked yesterday to Dr. Maddox that, you know, we should just mandate no man-to-man defense, just zone defense for basketball, and that will maintain social distance, but that's not going to happen. For instructors, a face shield might be a strategy that's going to potentially, now when I say protect, I want to unpack it. That is often used when you've been to the dentist. The hygienist might wear a face shield. That can provide some level of protection against splashes as they're doing procedures. We do know there's been some studies regarding choirs. There were a couple outbreaks amongst choirs in the Pacific Northwest. They have done studies to look at even down to the specific sounds the choirs make to see what spreads it more. It's the TH sound. Does that mean every choir is going to be in face shields? I don't know. That might come down as something that needs to happen. And I think Dr. Maddox would agree. Medical professionals would say, yes, that makes it safer. Please support the schools and institutions with the monetary resources to make it happen. It might be something that one instructor could consider wearing a face shield for a choir practice. With band, my daughter's also a flute player. That's the really only instrument I can think of that would potentially make this kind of aerosol spray. Do flautists need to wear face shields? It could be an option, not saying definitely needs to be a mandate. The point down at the bottom that we have, if there's a policy that's mandated, just like if you work at a restaurant providing a uniform, these face masks may become part of your new uniform, especially if they do become part of team wear. You obviously want them to be looking the same. If a choir or other group, you want everybody to look the same. You want to provide that so it makes it so they can comply with the policy and ensure uniformity. And I guess as a functional thing, make sure there's nothing on that mask you don't want representing your organization. Dr. Maddox, additional thoughts?
Yes, this is Dr. Maddox, and my additional thoughts would be mask on participants. Specifically, administrator meeting yesterday, his son was a wrestler. Having a mask on a wrestler would be very difficult. And then mask on a lineman in football, their size and with the heat outside is going to be another difficult situation with overheating. So we're going to have to use our training and be aware of all their medical conditions, not just COVID. We want to make sure we're aware of all their risks and everything that's in play.
I'd agree. I add one more thing too, that you have to, you know, Dr. Max, you probably say water, 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 water on the field all the time. The overheating is a thing. I might counsel possibly the coaches on the sidelines to consider a face shield because they're going to have heavy breathing athletes coming. You're going to be in close to give them advice on the next play or the next strategy. I agree with you, Dr. Mack. It's going to be hard to put masks on a wide variety of athletes, 100%.
Can you talk a little bit about equipment? Obviously, with a lot of sports, there's shared equipment. Could you maybe talk a little bit about that?
Sure. I'll start here, Dr. Nip again. I mean, I think we have to put recommendations out knowing that each, you know, there's going to be a different level of ability between a small T-ball squad versus a large high school team regarding sharing of equipment. There may be several helmets amongst a T-ball squad, and there's one for each player on in a different situation. I think continue good cleaning of the shared items and common touch as we have here: helmets, bats, flags, anything. Can you wear gloves? I mean, part of the uniform, it's already there. Soiled items, obviously, that's probably part of the usual thing to take the uniform home.
I mean,
and encourage that.
If I could piggyback on Dr.
Sure.
Dr. Maddox, you know, taking care of ranging from AAU travel baseball teams up to the tin caps. You know, the tin caps, every player has 5 gloves, 10 bats, and, you know, however many that they get to choose from. So not sharing equipment is easy. When you get down to these other teams, it's going to be what's feasible. You know, if you have someone that can't afford a glove or afford a bat, we're going to have to find out a way to help with that. And you're going to maybe need to deem someone on the team to be the sanitizer for the game or for the practice, and any shared equipment should be cleaned before it's shared, of course.
Can we talk a little bit about spectators at events? How do we do so while trying to minimize the risk of virus spread?
Good question. I think that the first point is, you know, we're going to need to follow whatever the state local guide demands or requires. The second point is very good. All the places, you know, the game or the event experience doesn't start, it includes obviously the theater or the stadium, but also parking lot. How do you use things like administrative controls? Is it one-way traffic, one-way walking, both with cars and people? What do you do for the lobby ticketing? Your concession stands and your restrooms, they're each going to need a solution. Maybe design or redesign your entrance exit for those. And limiting the number of people in each place is going to be something that probably I would think is going to be a reality. And I'd like to, before Dr. Maddox, Wes, do you mind speaking about concession stands here?
Yeah. I think it might be the next question.
It is, yep, perfect.
Yeah, so thank you. So concession stands, and my name's Wes Oburn. I'm the Director of Food and Nutrition for Parkview. Number of different things to consider on concession stands, and considering our audience here is broad from small to very large. So social distancing measures are key. Signage, floor markers, as Dr. Nip referred to as one-way traffic throughout your venues. Spreading people out is a really important consideration. Is it possible that you create multiple pop-up type concession stands that might be littered throughout the event center or the ball field or venue, whatever that might be, just to move people around and keep lines from forming? Touchless payment opportunities are something to explore now if you don't have that now. Obvious hand hygiene for your guests and for your the workers who are working behind the concession. If possible, a dedicated cashier. If you're going to accept cash at your events, having someone dedicated there is really the only way that they can practice hand hygiene well between each transaction. For larger operations, cool idea is to look at investing in some order ahead technology that your spectator can order from the stands, go to a specific pickup point and get their concessions there. We might think about some volunteer, I know lots of volunteers staff these areas, parents of children and things. And maybe they've done that for some time, but I think it's really important that we revisit the education that we're providing to these folks. So having someone designated in charge of the concession area is extremely important in my opinion. And having a check-in and a check-out process with these folks when they come in. Are they educated on what hand hygiene looks like, what social distancing looks like, how to properly wear PPE, how to treat a mask, when to change your gloves? I mean, it's a limitless slew of education that we can provide in a relatively quick time period, but for that person in charge to help with the accountability as they're observing the concession area. So I think those are all great things, and there's some resources also through the Business Connect folks if you want to email for that, and I'm happy to provide some more education if needed.
While we're on the topic of food, can we talk a little bit about team meals? Is that something that should be considered?
It can be considered just carefully. And how and where those take place at. I think that we need to be mindful of the governor's orders, of course, dining and seating areas. No self-service, social distancing practices, right? No more than 6 feet in between one another. Strongly discouraging the potluck type meal. Dr. Nip touched on our hierarchy of controls, and first step is to eliminate risk and things that you cannot control that may be prepared somewhere else, someone's home that you don't have a handle on. Are they wearing right PPE? Is the hand hygiene correct? Have they done symptom checks to those preparing it? Probably not is the answer to those questions. I know that's not what happens at my house. So I would say, yes, you can. Just be very careful. Look at more of a boxed lunch. Can you order out? Can you partner with potentially your school cafe? Or if you're part of a larger organization, like a university, can your dining services provide those sort of things?
We're going to jump and take one of the live questions. Can we talk a little bit about transportation when we get back to high school competition? Any discussion on transporting students and athletes, to and from a competition in a bus, extra protocols besides just the mask and 6-foot separation?
Dr. Nip here. So the beginning of that answer, the CDC does have some guidance out on that. I'd refer that query to there. I mean, I think, again, it comes down to, if you had all the resources in the world, what could you theory do? Because we want to recognize that for potentially a school corp, yes, you could just put less students on each bus, but that means more buses. That's an additional financial outlay, scheduling, et cetera, et cetera. I think the operative phrase that was on a slide a little bit ago was don't miss the good to hit the perfect. I think, if we continue to try and do making the optimal healthy choice easy, going back to the cleaning, the hand washing, wherever you want clean hands, put a sanitizing station. Can you get that on the bus? So clean hands come on, clean hands come off. If people can wear masks, I think that's a good thing too. But obviously there are constraints on resources to transport students to competitions or games or something like that. And it's just trying to, utilize whatever level you can on the hierarchy and continue to follow the baseline, which is the hygiene and the cough etiquette and those sorts of things. Dr. Maddox, additional thoughts?
This is Dr. Maddox. I would say, going back even further, I think in our schools with our certified athletic trainers involved, they're going to be keeping check and monitoring their athletes and knowing they're going to be a checklist of questions that, have you had any of these symptoms related to COVID on a daily basis? And the key is to not allow someone sick on that bus. So I think that if we're at the point where we're playing games and we're busing people to a game, I don't know how much we're going to be able to change that bus environment, but we can change the environment that gets on that bus and making sure that we have well people getting on there, maintaining good hygiene and not spreading disease.
Let's talk about social distancing on the sidelines. Can participants stand in a close row, sit on a bench? Do they need to stay 6 feet apart? Thinking about like dugouts and things like that for baseball.
Sure, this is Dr. Maddox. I'll start this one. If we're at the point again where we're playing sports, for instance, Heather's hockey son, if they're out there checking and knocking each other down and landing on each other, and then they come over to the bench, I would assume that they could be on the bench. While they're on the bench, we'd want them to maintain their social distance as much as they can, given the amount of space they have, not share equipment, clean equipment that's going to be shared, use all the guidelines that we're talking about here in order to minimize the transmission of any disease, if at all. Would you say anything, Mike?
I agree.
What are some of the creative ways organizations are offering activities?
I know at Parkview Sports Medicine, our performance team, including Scott Charlin and Tommy Shagler, the head of, have come out with a Zoom plan, and we've tried to help the local high schools get their kids in some shape during this time when maybe some kids have been laying around a little bit more than they should. And we've had a great turnout, and it's been a very positive feedback. And it's led to a lot of kids then being interested in, now we're starting to offer some classes now that we can open up our facilities that are appropriate with the state and local guidelines. It segued right into keeping these kids in shape and getting them ready for when sport is really active.
I would agree, and just to touch on the other things there, I know our daughters tried out for Maple Creek virtually this year. They just submitted a video of a song and a tryout dance that came across on YouTube. I like the idea of live streaming practices, maybe a competitions. I don't know what the landscape is going to be, even for sports, if it's parents and referees only, or if it's, I think, monetized viewing. People are used to paying some money to get in the facility. They could pay, you know, some electronically to be able to view the performance. And I think there are good ideas out there. It's just adjusting them to a new, it's going to feel different, but we can still share that good experience of extracurricular sports and everything.
And I think this is an area where a lot of the local coaches probably fall into a high-risk category. In order to keep them involved with the team, we're going to have to use some of this technology.
Let's talk a little bit about who makes a decision on what is or is not done.
This is Dr. Maddox again. Of course, you know, we start with the state and local governments, CDC policies when making these decisions. And then when it comes to the decision of who's playing, based on quality of play, that would be coach. Based on wellness, that would be our athletic trainers and physicians and, you know, trained medical care providers making those decisions. Do you have anything else to add, Mike?
I think so. The one thing I think we were chatting about, Dr. Maddox, the other day was may need to switch to only intra-conference play for this year, because some conferences may have different rules on who, when, what, where, why, and how. But I think it remains to see what is going to come out.
And we've had meetings upon meetings, so it's difficult. The hope is that IHSAA comes through with a very solid policy that's in line with our surrounding states, and all their policies are very similar, kind of like concussions. The fear is that doesn't happen. The timing of when things can happen will be based on your state and local authorities, but hopefully those overall policies coming from the IHSAA and Ohio and the other areas will be very much in line with the CDC, very, very much in line with what Parkview is doing. And so it'll just seamlessly fall into place. And so your conference at EECS will have the same status as SAC conference and so on and so forth. So we can play each other and know that your kids are safe on my campus and my kids are safe on your campus.
You mentioned a couple questions ago that, you know, number of coaches maybe fall in that vulnerable population environment. Can you talk about, you know, if participants or other staff kind of fall into that vulnerable population, how can we keep them involved?
Sure, great question, John. I'm going to actually also loop in a live question with this answer as well. So we wanted to just unpack vulnerable because that's been in the news. What we want to unpack is to say, you know, we all, as this is a novel virus to our species, we all have an equal risk of being infected, but we have a different chance for a more serious course or complications based on our individual biology, also some things like age and people with certain underlying conditions. And so I wanted to point there at the second point, physician qualifies those who are vulnerable. This is, the live question was regarding IHSAA on sports physicals. Ones they did last year could count for this year. Should they get new ones, or just if people are risk factors? Again, I would widen the lens to say, again, if they've not been into pediatrician for a while, it's a very good chance to get back in. It should be at least, I think, a conversation with the child's physician regarding how are they doing? Is anything changed? That sort of thing. I think we talk about super user at an employment, but also a super user regarding an organization, because there are great opportunities for kids who maybe have one of these underlying conditions that makes them vulnerable, or developmental needs that is going to make the current new normal a little bit more for them to process, and to have them have potentially an organization designated person to develop a plan, help explain, give that extra mile to be able to let them participate and create a plan, like we say here, to have accommodations to that as needed. Because as we know, participation is important for social emotional development. It's great for the adults that are involved as well. It's great for the kids. The other thing too, I will touch on is staff who may be in this situation. Dr. Maddox, you mentioned that maybe some of the coaching staff or the directors may fall into a vulnerable category. They may need extra accommodations regarding equipment or the ability to virtually do something. If they are employed, not a volunteer, there is a fairly standard process. Health docs do this all the time on working on what accommodations can be made in partnership with that person's treating physician, the employer or the organization, and that patient.
This is Dr. Max. If I could just add on the pre-participation exam, as of yesterday, I called 877 PPG today, and you can schedule a wellness exam with a participation physical. And of course, Parkview Sports Medicine has voiced over the last 4 years, you should get these done with your pediatrician, primary care physician, so they can do a complete screening, make sure that you get your immunizations that are indicated. They know you better. You should spend that time. It's a much better exam than in a gymnasium with a cattle call format.
The next question here will bring in Mindy Waldron from the Department of Health here in Allen County. What steps should be taken if a participant tests positive?
It would be just like if anyone tested positive in any other work environment, but perhaps they're associated with sport. And sometimes because of their connections to how many people they may have been around, it kind of expands what the contact tracing or the reach outs might need to be. But briefly, anybody that does test positive and is considered a positive case for COVID-19 will receive a call either from the local health department or the state Department of Health. And then we work through whether they were symptomatic or asymptomatic at the time. And if they were symptomatic, and this is relatively confusing, what will be helpful is when they send the slides out, you'll have that. And if you have additional questions or experience a case, feel free to call us. But more or less, if they're symptomatic, they do have to remain in isolation so we can protect others from them for 10 days. Or until 10 days has passed since their symptoms started. So whenever they had their first symptom, that sort of starts that clock. They also must be fever-free for 72 hours without utilizing something like Tylenol to reduce that fever. And they need to show an overall improvement in their symptoms. So there are certain things that we would caution against returning to play or school or work if you still had certain symptoms. Now, if they were asymptomatic and they were just tested for whatever reason that might have been, and they didn't have symptoms at that time, but they did test positive, they do have to remain in isolation until 10 days has passed since the time that they had the test. And generally, isolation is done in someone's home. Now, close household contacts, and then that would also include roommates if you're staying with a team, or if you had close teammates that either you traveled with or that you were in close contact with throughout certain events as those begin to open up. Those people would also be reached out, because when we reach the case or if the state reaches that person who's positive, they're going to ask them who they were around so that we could reach out to them and help advise them as well. Again, it's about reducing the continued spread of the disease. So those folks then would have to stay home and complete what we call quarantine period. And that 14-day period generally starts on the last day that they were exposed to the person who has become positive, because we know that was the last time they were around them, and then we need to sort of watch them for that 2-week period for the development of symptoms. Or if they can't be isolated, so if you have a household contact who's a mom that's around the child who's sick or vice versa, if we can't separate them, it extends that period of time that they have to be in quarantine. So every case, as you can see here, is very situation specific, and we advise each one based on those scenarios at hand.
Mindy, this is Joe Maddox. I'd just like to say, big picture for everyone listening. The takeaway is return to sport is the same as return to work. We don't have to recreate the wheel here.
That is very correct.
So let's talk about if a staff member or participant tests positive. Should members of the team or group quarantine? Do we close the facility? If yes, how long?
And again, this is relatively similar to what schools have been asking and businesses for the most part. So we, as was said at the very beginning of this particular webinar, is that COVID-19 is with us now. And as we do leave our homes to get back into work or sports or other things, we do assume a little risk there. It's just one of the things that now we will all be exposed to potentially, and we have to know it's going to happen. So it shouldn't be surprising. When it does, though, one thing we tell everyone, no matter what the exposure date was, no matter what the situation is, you should be vigilant for watching for symptoms now anyway. If you're around people that you haven't been around for a while and you become symptomatic in any fashion, especially have a couple of the symptoms that are indicative of COVID-19, should take that seriously and look into that. So if we do have somebody that tests positive, we would likely identify as many as we could that were around them, and they would be self-monitoring if they were not considered high-risk contacts. High-risk contacts, as they show on the slide here, they've at least expanded that a little bit. That constitutes being within 6 feet of someone for more than 10 minutes and not wearing appropriate personal protective equipment. And that would be likely what would be happening at a game or in the spectator area. So high-risk contacts that spend a good time around somebody who becomes positive, those folks would go into quarantine just like we discussed if you were a close contact to someone living in your home or at work. Same goes with sports or in an attendee area. And again, very situation specific. We make judgment calls nearly every day on every single case as to what is high risk and what is not. If, however, there was an entire event or a group of folks that were participants or attendees, say parents or whatever, or traveled on a bus would be a good example for sports, and they meet that high risk criteria, yes, unfortunately that event or those types of sports would probably have to be stopped for a period of time, and that particular group would need to be watched and separated from others. We also know that there is such a thing as asymptomatic spreading of this disease, so you may not show symptoms and still could spread it. So that's always a complicator. So we want to try and separate folks for that time frame where they could develop the disease and watch them. If it's part of a larger facility, say a large venue, once those start opening, or your school, if you have a school sport, it's very situation dependent. Where were these folks? Where was this person that was actually diagnosed? Who were they around? Were there certain other areas in that facility that were unaffected? So situation specific decisions are made about whether something has to be closed. And for the most part, facilities make those decisions on their own with our council.
So I will remind everybody, we do have the question and answer tab open at the bottom of your screen. We've got one last question that's up there right now, so we'll take that. And if anybody has any others, please get them typed in quickly. Yeah, how do you consider several baseball fields in an open area? Is each a separate instance of gatherings?
I'll start with that one, and then anybody else can jump in or add a question to it. We've been fielding hundreds, if not close to 1,000 interpretation questions from everybody asking, what does the governor's order mean in certain areas? And if you're not familiar with the stages, once we get to the stage like stage 5, when there's less restriction on numbers and then it becomes about safe practices, that's when it expands a little bit and we look at how do we do social distancing, all the things they talked about here today. Currently in the stage that we're in, and until we actually get to stage 5, for the most part, the intent is that an event or whatever is attracting people to a site is all one, regardless if they're slightly separated by fields, because generally what does happen in those fields is they share a concession area, or parents go or people go between games. So what they're trying to do is spread things out as they reopen them. And currently we would be looking at the 250 amount, say in stage 4, would be collective to the event, regardless if they're slightly spread apart. That's their intent. Now, good judgment's always going to be used, hopefully. And as long as you have some social distancing and other safety hygiene measures in place, we understand that everything can't be completely separated, but waiting till stage 5 for larger events is certainly what's recommended.
Mindy, we've got a hypothetical question on the online here. One student athlete tests positive for or experiences symptoms, lives with 4 other teammates, recently traveled to a game on a bus. None are at high risk, all but the one are asymptomatic. Suggestions on, continuing forward as a team.
And I assume when they say that they live with the other 4, like say at a college, I'm guessing.
Yeah, this is coming from one of our college.
Recently traveled to a game on a bus, none are high risk. Well, the high risk part is the closeness, but if they are household contacts normally and have lived together for, let's say, half of the semester or some such thing, they are not a lot different than living with parents and kids in a home. So that's how we would look at it. We would consider those folks as household contacts as we make decisions. If they're asymptomatic, that's good. They would still be considered folks that would have to be in quarantine until they went through that period, because we would have to probably consider things when this person became ill. What were those symptoms? Those types of things. So it's very hard to answer that one on the fly because there's a number of underlying questions that we would ask to make that decision. So if this is an actual case, I would just encourage them to call our office and we can walk them through them very easily utilizing the algorithm.
Okay.
Hi, John, it's Dr. No. I just want to add one thing. I agree with Mindy. I want to do what the health department tells you to do. I want to talk briefly about attack rate, which I don't know if we brought that up. So that's the situation, like college athlete roommates. How likely is it for one of them to get it if one of them is sick? So we do have some literature out of China and Asia regarding that, looking at confirmed COVID cases. What was the rate of infection of spouses, children, other people living in the house? I'll put a small g good news. It looks like it sat around 15%. I mean, the basics are the basics for a reason. They're good to do. Isolate that person at home. Don't share, if you can, bathroom towels, utensils, cups. Have them stay in their bedroom if they can. So even that, we're used to maybe mom or dad gets the flu. Everybody kind of gives that person their own space. So it doesn't mean we don't follow the standard procedure from the health department. I wanted to just offer it as a nugget of reassurance that if we follow the usual process, we can hopefully stave off a lot of people getting infected secondarily. But we have to use the process, meaning being vigilant for symptoms, partnering with the health department so they can give guidance for what everybody should do to produce the optimal outcome for everyone.
Well, I want to thank everybody for taking part today. I want to thank all the presenters. I want to thank all of our partners, Parkview Health, Greater Fort Wayne, Inc., the Northeast Indiana Regional Partnership, and the Allen County Department of Health. If your question was not answered, and if you have additional ones, please utilize Parkview's newly established website and submit your questions. As always, we're here to help you, and we want to be here for you. If you have any questions, feel free to reach out to our team as well. I hope that you all have a good day. Thanks for being here.